I will say it sort of fascinates me now looking backwards, because I can't imagine doing anything else.
Your current research interests include nutrition and exercise for the elderly. As a geriatrician, can you remind our viewers why these things are important, especially in old age?
Yeah, exactly. I'm glad you added the especially part, because I think a lot of times people think of aging as winding down. You know, that's you're just spending time. We're getting near the end and giving up, just kind of waiting for time to pass. But that's not how most people, as they age, experience aging. They still have a lot they want to accomplish, regardless of how much time is left. And so there's quite a lot of room for prevention in aging work. And I think it's important to keep in mind that, food is our biggest medicine, and you can benefit from changing your diet at any age. Actually, the benefits you incur in terms of reducing blood pressure if you reduce salt, for example, or reducing cholesterol if you go from a meat-heavy diet to a vegetarian or vegan diet, is very quick. It's in the matter of weeks. So those issues are just as important, or probably even more important as we get older, to try and stave off frailty and to keep us functional and independent as we age, to eat well and to stay physically active.
As a primary care physician yourself, you said that you don't understand why more med students choose to go into primary care. Why do you think it is that fewer do?
I think one big issue, primary care gets a terrible rep, right? So, you hear about, gosh, in primary care, you work really hard, there's not good support systems, you're underpaid. Why would you do that? If you're a super smart Hopkins medical student. So I think that the reputation around primary care needs to change. What we do in primary care, okay, I'm not in the highest paid specialty, but I have awesome relationships with my patients. I get to make a meaningful difference in people's lives. That's pretty great. And I don't think students always get to see that side of things. They hear the reputation. They often don't have much exposure to primary care during medical school. I think the other piece related to that is it's very hard to love primary care in the way that we train students now. The thing that most people go into primary care for is these long-term relationships. You get to know everything about your patients' lives. You become a trusted advisor. And that takes seeing them back over and over again. And the models in which we train students, they often don't have the exposure to a patient over and over again. I've often said, if I could just have every student meet 5 of my patients, they would fall in love with geriatrics, because I have the best patients.
Dr. Christmas, thank you so much for your time.
Absolutely, my pleasure.
That was a CLOSLER look.